So what they do, and you see this a lot from the left, and I hear this in the debates, and I'm amazed. This is one thing that hopefully you guys understand and see this sort of bait and switch that happens a lot. The left, what they do is they say, hey, the United States, we spend too much on healthcare. Understood. We do have a system that's broken. It's not flawless. They say every single other industrialized country has socialized healthcare. Okay, they're not necessarily all the same kind of system, but I do understand they have something more similar to what you would see as socialized healthcare compared to the United States. And then they say they spend less, and by the way, they have better healthcare. By the way, they rank Venezuela above the United States. This comes from 2 studies. Okay, this is important to note. What they do is they talk about healthcare, and they talk about the problems that we have in the United States objectively, and we do have problems. And then what they say is these healthcare systems in other countries are better, and all of a sudden they start pushing subjective ratings. Comes from 2 studies. Comes from one is the World Health Organization. They did their global rankings, okay? Has the United States ranked right between, if I'm not mistaken, Slovenia and Colombia. Yeah, go in next time you need to have a root canal. Pablo Escobar shows up. I mean, it is unbelievable. And then there's one other one. The more recent one was the Commonwealth studies. So these are the only 2 studies that I know of. And by the way, the Commonwealth studies, I believe that was the organization. We wrote about it on the website. They listed 11 different countries for healthcare. And they ranked them. And they said, okay, these are the best from best to worst. Do you know who's ranked 11th? The United States. Do you know who was ranked number 1? The UK. Now here's the thing. How did they come up with those rankings? Does anyone here, even if you're a liberal, does anyone here believe that our healthcare is not as good as Cuba or Slovenia, for God's sakes? No, of course not. What they do is say we have problems, and then they say these people have better healthcare. Why? Because they're happier with their healthcare. Well, that doesn't matter. If I give somebody a shit sandwich and they're happy because it's free, it doesn't mean that it's better than me having a meal of broccoli and chicken breast and quinoa, right? You can say all you want that my meal's more expensive and the person who's starving who has a crap sandwich is happier with it. That doesn't mean that it's objectively better than the United States.
All right, so there's a lot to unpack there, but before we get into it, you know, one of the things that genuinely mystifies me about people like Crowder, or Ben Shapiro, or Charlie Kirk is how little respect they have for their audience, and how much respect their audience seems to have for them. Like, really, Steven? You think the people in that audience are so gullible that they believe that these studies about various countries' healthcare systems are only based upon whether people are happy with their healthcare or not? Honestly, if you're a Steven Crowder fan, or even if you're Steven Crowder curious and you're watching this video right now, here's my advice. Have some respect for yourself, and don't let this asshole take advantage of you. But let's break this down. So Crowder mentions the World Healthcare Organization and the Commonwealth Fund's rankings of world healthcare systems as the basis for everything he says here. And, as indicated while he was giving his rant, he was either blatantly wrong or lying when he said that Venezuela and Cuba are ranked higher than the US. But I don't want to hurl insults here, so let's give Crowder the benefit of the doubt and say he's just misremembering the numbers. He then goes on to make 2 claims about these studies. And these are basically that the WHO and the Commonwealth Fund are incorrect because, number 1, obviously the US has a better healthcare system than these other mostly Latin American countries. Why is that obvious? Well, Crowder doesn't really say why, he just asks, and I'll quote, "Does anyone here, even if you're a liberal, believe our healthcare isn't as good as Cuba or Slovenia?" Again, Cuba is ranked lower than the US on the WHO ranking. But beyond this factual inaccuracy, there's simply nothing else here. Crowder's answer to why America has a better healthcare system is basically, America! Fuck yeah! Alright, now even if we decide to give Crowder a pass on his factual inaccuracies and this completely emotional take, let's move on to his biggest issue with these studies, and that is that they're subjective. Meaning, Crowder believes that the way these studies measure healthcare isn't reliable because they use surveys as data. And people in these countries with some form of socialized medicine will, of course, report that they're happy with their healthcare system because it's free, and because they have no idea what a good healthcare system would even look like. Their healthcare, according to Crowder, is a shit sandwich.
The review you had on Shark Sandwich, which was merely a 2-word review, just said, shit sandwich.
And these people think it's good for them because they've never been introduced to healthier sandwiches or foods like quinoa and broccoli and whatever else he said. So let's go to the reports to see if Crowder is correct here. According to the World Health Organization, to assess a health system, one must measure 5 things: the overall level of health, the distribution of health in the population, the overall level of responsiveness, the distribution of responsiveness, and the distribution of financial contribution. To put it simply, there are three broad categories that their study looks at: health, responsiveness, and financial fairness. Because the level or quality of these goals and the distribution or equity of them is also super important, these further criteria are factored in as well. So now that we know, broadly speaking, the factors that the WHO is looking for when evaluating a healthcare system, we might wonder, how do they determine whether a system is performing well or poor in these categories? To listen to Crowder, you'd think they simply ask patients if they're happy with the service they've received and then write up a little report about it. But let's see what this report actually looks like. So as you can see, this is a 215-page, extremely wonky report. So we'll look at just a couple of excerpts in the interest of time and my inability to make this kind of stuff all that engaging. Unless, of course, you're into like per capita health expenditures and child mortality rates and stuff like that. But anyway, this first example shows that in order to better understand causes of death in the 191 countries included in the report, the authors used national vital registration systems that captured 16.7 million deaths annually, along with information from sample registration systems, population laboratories, and epidemiological analyses of specific conditions. And this next example shows that in order to measure fairness of financial contribution and financial risk protection, the authors started with the concept of a household's contribution to the financing of the health system, which was defined as the ratio of total household spending on health to its permanent income above subsistence. Meaning, they used math, Stephen. Also, how about this? That is, the selected National Health Accounts Indicator Table that looks at the health expenditures of each member state in great detail, including public expenditure as percent of total expenditure on health, tax-funded and other public expenditure, Social Security expenditure, etc., etc. And believe me, I could go on and on and on. The short of it is, if you spent just 5 minutes looking at this document, which Crowder's betting you won't do, even though it's freely available on the internet, you'll see that it is an extremely detailed, empirically driven report that went to great pains to gather a tremendous amount of data, not just personal surveys discussing patients' likability of their healthcare provider. Now, if we're looking at the Commonwealth Fund's ranking, we can see that in order to synthesize the data for their report, they use 72 indicators in 5 domains. And those are care process, access, administrative efficiency, equity, and healthcare outcomes, with their data coming from international surveys of patients and physicians and selected measures from the OECD, the Organization for Economic Cooperation and Development, the WHO, which we just talked about, and the European Observatory on Health Systems and Policies. So maybe Crowder is half right here, or like, I don't know, a quarter right, an eighth right, meaning yes, the Commonwealth Fund did use patient surveys as one of the pieces of data for their report, but they also surveyed healthcare providers and used measures from other institutions. What's really important here is what these surveys ask. And again, to listen to Crowder, the survey was basically something like, are you happy with your healthcare? Yes or no? So let's look at the data. As you can see, the questions asked were much more detailed than Crowder made it out to be in his rant. The survey asked questions like, have you talked with your provider about healthy diet, exercise, and physical activity in the past 2 years? Have you experienced a medical medication or lab mistake in the past 2 years? Have you experienced gaps in hospital discharge planning? Have you skipped dental care or a checkup because of cost in the past year? And questions like those. Of course, that isn't all they looked at. We can see here that the Commonwealth Fund, like the World Health Organization, also considered infant mortality rates, life expectancy, breast cancer survival rates, and much, much more. So like I said before, if you're a Steven Crowder fan, or even if you're on the fence about him, you really have to ask yourself some hard questions. Like, why is he making it seem that these studies are unscientific and completely subjective? Did he not look into these reports at all, or is he lying? And why does he spread this misinformation on college campuses in particular? And the answer is, that's right, it's the economy, stupid. Or rather, it's the people who fund Crowder. Again, the billionaire oligarch class, who want to rig the economy so it benefits them and strips regular working people of any kind of agency.